Hi, this is James at Cerritos Dental Implant Center. So another question we're going to cover today is a question we get asked a lot by patients at the office or by a lot of people that come to our office is, are more implants always better? The answer to that is depends, not necessarily. So what's good is to have the correct number of implants placed. The correct number of implants placed is not always having the maximum amount of implant placed. Because we're going to see in a minute from the next case, having too many implants can be a problem. So let's take a look at this patient right here. Oh my goodness, that's not good. What's going on here? So for this picture, I want you to take a look at the lower left-hand corner. Let's take a look at those implants. That doesn't look good, right? There seems to be pus coming out of there. There's bacteria in there. There's blood. Oh, that doesn't look good. So even if you're not a trained expert, you can take a look at this picture. Something is going on here. Something is not quite right. So this, unfortunately, is one of the implant complications that come to us. We get a number of these cases. A lot of dentists out there just don't quite know what they're doing when it comes to dental implants. So let's go ahead and take a look to see basically what the problem is going on for this patient. Okay, so let's take a look at the lower jaw. See all these implants right there? Patient had about 9 implants placed in the lower jaw. For this patient, that's too many implants. So for a lower jaw, for something like this, you would only need about 4 to 6 implants to really get the job done. 9 is just overkill. So you can even get away with 6 would be good. Even 4 would be adequate for this patient. So when you have this many implants, they're too closely placed to each other. It doesn't give enough room in between the implants. Keep in mind, you at least want 3 millimeters of bone in between each of the implants in order for bone to grow back, in order to be stabilized, and also the patient needs to be able to clean whatever prosthetics or restoration that the implant goes on top of. Unfortunately for this patient right here, none of those factors applied, and she is the case that she is right now. So here's another slide of, you can see the implant at another angle. So you can see from it, the implants are too closely placed. They should be more spread out, and there shouldn't be this many implants. So let's take another look at it. You can see from the angle what's going on here. Too many implants, not enough to know where to clean. If you look at the gums on her lower jaw, you can see a lot of that stuff's all inflamed. So patient, she's not very happy in this situation. It smells, it hurts, and the implants move, so she's not a very happy camper. All in all, everything is going as in the worst possible situation for this patient. So for treatment planning for something like this, you just have to remove these failed implants. There's no reason to keep them in there. They're already infected. It's giving her more problems. You just have to remove everything. So this is what, after you remove it, basically take a look at it. Look how close these implants are to each other. That is not good. Not optimal implant placement. As we said before earlier, you want at least 3 millimeters of bones in between each of those implants. You want to space it out accordingly. So given her situation in something like this, she has a number of options. After we remove those implants, she can have the all-on-4 procedure. So if you have more questions on all-on-4, just Google it or YouTube it, just type in all-on-4. That's basically having 4 to 6 implants placed and basically having an implant denture attached to it. Patient can also basically have 4 implants placed and use a sincone abutment. So sincone is basically made by Dentsply. These are different type of connection types. That would also be an implant denture supported restoration. For sincone, it's going to be a little bit different than all-on-4 in terms of sincone. It's removable. So at night, patient can remove the denture and it'd be easier for her to clean. All-on-4 would be a fixed restoration, so basically meaning that you cannot take it out. It's basically fixed in place and it's always going to stay there. Or the patient has a third option, which is basically placing 2 implants and using implant locator denture. So basically what that would be is having implant denture and securing it in place with 2 implants. So the most economical and the easiest of all 3 options. So for patients like this, it just really depends on her to see what would be the best option for each patient. As we said before, for this patient, she's in a financial situation and also oral hygiene is a factor. So for her, she opted to go with the third option, which is implant locator supported denture. So looking at this x-ray, basically, if you look at the lower left of the screen, 1 additional new implant was placed. And if you look at the implant towards the middle on the right side, we saved one of her existing implants and put a locator on that. So for this option, most economical and the least amount of surgical procedure was taken. Keep in mind that she's in her 80s. She doesn't want to go through a lot of surgery. She probably can't sit through a 4 or 5 hour operation. So all-on-4 would probably not be a good option for this patient. Okay, so this is the implant denture. That's basically going to go on top of the implants. This is another view of those implant denture with a locator housing abutment. That's the blue portion you see right there. Okay, so this is basically when the locator basically goes on top of the implant. So you see from the yellow portion right there, these are the implant locator that's going to stabilize her denture. So the denture is going to be removable, so at night she can just pop it off. Very easy to clean, so oral hygiene will not be an issue for her if she's going with this option. So our final picture here, this is basically the implant denture when it's connected to the implant locator. And this concludes our video for today. So in summary, let's go over the main points that we learned today. Having more implants is not always better. It's very important to space out the implants to achieve the maximum effectiveness for the implants. And the second point that we want to emphasize today is that each individual needs are going to be different, and every patient is going to have a different financial situation. Therefore, it's very important for the dentist and the patient to both come into agreement to see what is the best treatment for each individual patient. Okay, if you have any questions, feel free to email us at help@cerritosimplant.com. Until we meet again, this is James at Cerritos Dental Implant Center. I'll see you in the next video.